Hey everyone, this is Dr. Jamie LaViola with Dental Masters, and we are here today with another episode of Ask Dr. J. And today we're going to talk about your bite. We get all kinds of questions. Should I get braces? Should I fix my bite? And there's not really one size fits all or one answer to this question. So the truth is, it just really depends. Everyone's different. You can have an overbite, you can have an underbite, you can have it when you're younger, when you're an adult. So when I'm asked these questions, should I have braces or should I get this corrected? Again, it just depends, and let's talk about why. An overbite is a description of how your teeth fit together. It's an anatomic, or it's a description statically of what's going on, of the position of the upper jaw to the lower jaw. Meaning your overbite means that your top teeth come over the lower teeth like that. An underbite is exactly the opposite. Your lower teeth come outside your upper teeth. And again, this is a static position. It doesn't mean that the bite is not working. So let's be clear, function is not the same as anatomy or morphology. So that may sound complicated. What do I mean by that? What you're doing with your teeth and how they're working, are they working effectively and efficiently? Are things breaking down? Is not dependent always on how the teeth fit together. So again, it depends. There's no way to predict if an underbite or an overbite is going to create damage in the future. Now, if you don't like the way your overbite or underbite looks aesthetically, then yes, that would be a reason to go get corrective orthodontics, or sometimes if it's severe, what we call orthognathic or jaw surgery and braces to correct it. And for children, if it's severe, it's not a bad idea to go have that taken care of to prevent those problems from coming on, or onset of a functional problem. So there's all kinds of bites, again, that can occur. And on top of that, we see very often people that have been through braces and they have a perfect fitting bite according to the orthodontic classification, what we call a class 1 bite, fits together beautifully. And these are some people that I see more frequently than not that have TMJ issues, problems with their joint, their muscles, because after the teeth were put in that position, there was no consideration for growth after the braces, and then their jaw kind of got locked in this perfect bite. So again, bite is not an indicator, or how your bite looks is not an indicator of what's going on with your teeth. How do we figure that out? The only way to know is for you and your dentist to have a discussion, a really long form. Here at Dental Masters, we have 12 questions every year. We add a couple more. I know it's an annoying form, but the questions are so important. I cannot diagnose your bite, your function, and tell you what is necessary, what's going on, without answers to these questions and having a discussion with you on what that means for you in your life. I can look at your teeth. I can look at models, or today we do 3D digital printouts, and I can even see wear on your teeth, meaning the teeth are worn down, the points of the teeth are worn, and that doesn't tell me what's going on. It tells me that there was past damage or activity. It doesn't tell me that there is current activity that is creating a problem. So very complicated question. It's one of the things that I learn every single day, because each patient is different, and it's one of the most misunderstood things amongst dentistry. Not enough dentists study this. I'd like to give credit to Dr. Kois. He is the master of occlusion or bite science. So again, this question is, what should I do? Is my bite normal? It's not a one size fits all. And I would caution you, if you get a very quick, eager response to correct a problem that you may not have, again, unless aesthetically you would like to make a correction, I would really caution you and maybe go for a second opinion, because the science of how your teeth work and function, which is really the science of how your bite is working, is complicated and really needs a full dialogue and answers to questions to figure out what is happening and what are you doing with your teeth. So I hope this was helpful, because the reality is this is not a simple question, and you're looking for someone that is not going to do a quick treatment recommendation without a thorough, comprehensive evaluation and diagnosis of the actual issue. Thank you for tuning in to another episode of Ask Dr. J, and we'll see you next time.